Um, Actually, the purpose of this session is mainly just give an idea, like how can you just have a quick revision of what you have prepared for your anesthesia exam, and this is with the special reference to the intermediate module exam, which is occurring in back in Pakistan. Okay, so my main audience will be them, but the general principles will be applicable to all of you. Okay, so please, if you all of you who are not like appearing in this IMM exam, just raise the hand so that I know that you people are appearing, and rest of them will definitely get benefit, because I'm just trying to give you an overview idea how to, because sometimes if you know what you should know about a topic, it becomes easier for you to predict what may be the possible points, questions that like what may be the possible task on which they can prepare MCQs. Okay. So who among you is appearing in? Yes, Mariam. So I will ask you to take the lead. Actually, if I just want to explain to you this thing, actually there are usually two different sort of exams. One are basic sciences based, okay, and one is like a combo, both clinical sciences as well as basic sciences. So what makes intermediate module for you people more tricky, that it has both. It is a combo exam. It's not only clinical sciences exam, or there is a basic sciences exam. Then another problem or thing which create problem for you, that you should try to differentiate whether it is whether it is part of course of IMM, or it is not included. Am I right? Is it like that, Mariam? Mariam, are you around? Can you hear me, Mariam?
Yes, sir.
Yes. So actually, this is another problem which, so there is no differentiation. Like, for example, some people say that this thoracic anesthesia is not part of thoracic is not part, okay, and then ICU is not part. Am I right? Is it what you people know?
Yes, sir. Plus pain का भी कहते हैं कि वो भी part नहीं है.
Okay, so pain. What else? Try to speak in English, because there are some international audience as well. Okay, so I tell you something. Believe me that please come out of this differentiation. There is no differentiation. I tell you something. There is what is the main? If you just take example of thoracic anesthesia, for example, do you know about what is hypoxic pulmonary vasoconstriction? Yes, Mariam. Don't be don't feel any pressure. Okay, just be relaxed, because we are not I'm not your examiner who is taking like I cannot come out of the mobile. So just feel free to speak out, or any other person who is going for IMM, just please raise the hand. Mariam is one of them. Who else is going for intermediate module? If you will be interacting with me, it will be easier for me to discuss the thing. Otherwise, one-way traffic is difficult. Please. So anyone what is hypoxic pulmonary vasoconstriction? Which is a main concept in thoracic anesthesia, because when there is, for example, the concept is that where the air is not going, the vessels of the pulmonary vasculature also constrict. Okay, so that they are trying to avoid the shunting, because otherwise, if deoxygenated blood is bypassing without any air going to the systemic circulation, then it will be causing shunting. That is what is concept of shunting. So this is a main concept which is there for thoracic anesthesia. So for example, if you say that thoracic is not part of an intermediate module and you don't read about it, there may be some question, because it's physiology. It's nothing more than a physiology. So there may be you may find a question which is based on hypoxic pulmonary vasoconstriction. This is one thing. Another thing is that ICU. What is ICU? ICU, any patient who becomes decompensated, you can say that is critical care. Okay, so if you just, even if for example there are only few topics which are specific to ICU, there are only few topics which are specific to ICU administration, ICU admission criteria, critical care outreach team. There are only few topics which are specific to ICU. Otherwise, any patient who becomes serious is actually critical care. Pain, any surgery for which you need to give analgesia, the concept of multimodal analgesia, they can ask you in the intermediate module. So the purpose of these few words is to make you people out of this distinction that there is something different between intermediate module and FCPS, or any people who are appearing in any other exam back home. Don't try not to differentiate between because otherwise you will miss very important things. Okay, so this is another important point which you should be very clear about. Okay, so try not to differentiate, rather it's just like a dress rehearsal of FCPS part 2. So take it as full-fledged exam. If you just try to think that it is something halfway, or you just try to target the MCQs, you may be in trouble. And the people who fail in intermediate module, I can guarantee you, they are only in this confusion, whether this is part of FCPS or whether it is part of intermediate module. So please just try not to miss anything, because if you don't have concept of any important thing, you will be caught in trouble. Okay. So this is an important thing. Please, I am conducting this session purely for people who are appearing in intermediate module. Nobody is speaking out. I should just finish the discussion if you people are not interested. Because if you will not speak out, I am not delivering a lecture. I'm just trying to help you out how you should be preparing for it. So please, whosoever is appearing, just please talk to me, so that I will be able to help you out. Anyone who has got some questions, just share to me so that I can open them and we can discuss. Yes, please speak out. What is your name, iPhone?
Dr. Kamal, sir.
Dr.
Sir,
Kamal,
actually, I'm not not appearing in IMM, but MCPS recently. Soon I have my exam.
Oh, okay. Anyone who is appearing in the intermediate module, please, because you are making me disappointed. I am just sitting out with a lot of sneezing. I just took antihistamine and I thought that I may be helping you out, but nobody is. Mariam, would you like to speak out something, or should I just finish the session? Because if it is you people are not interested, then I should not waste my time. Okay, and if you just want to figure out this last 15 days, how you should be targeting, I will suggest you. Yes. Okay, how you should be targeting. My one suggestion will be that you can divide all the units like gynae ops, peds, okay, cardiovascular, okay, cardiovascular, then respiratory system, endocrine, okay, orthopedics, pharmacology, okay, you can make your own plan, okay, and then you can just divide last 15 days, because 15 days are left for your exam, okay. So the last things you can just divide your course, and then what will you will be doing. For example, today you say that your day is for gynae ops, okay. So what you will be doing, you can just divide, just give me a second, please. Okay, so what you can do, that if you are doing this gynae op, so you just think what may be the possible questions which may be part of it. So the things which are high yield are related to physiological, pharmacological, and anatomical changes. Okay, so one part will be related to it. Like they will be making question, the main base of it will be related to these changes. This is one thing. So you should be knowing when these changes start and when these changes end. Okay, so like for example, they will be asking you related acid prophylaxis. So Zishan, if you can just recall in which week the
14 weeks. Acid prophylaxis is needed after 14 weeks.
14 weeks. Okay. So if they put this question, you should be thinking this point will be the key, that you should, whatever question they are making, you should be knowing that this for, and I think it remains after how much time postpartum?
So I think 2 to 3 days, 48 to 72 hours.
Because progesterone, it is related to progesterone. Okay. So if you know that what time progesterone levels are decreasing, you can tell. So you should be knowing about it, because if they have a surgery postpartum, after they will be doing anything postpartum. Okay. So this point will be, so any points or anything related to the physiological, pharmacological, and anatomical changes in obstetric patient. So this is the first thing you should be revising, and you can revise in 1 or 2 minutes, that what are the changes, how much percentage of RBC volume change, how much cardiac output change, when is the maximum cardiac output, because all these are MCQs which they will be asking you. Similarly, in respiratory system, how much FRC is reduced, how much minute ventilation increase, how much respiratory rate increase, how much. So any question will be related to, you can find some question which will be related to this point. Okay. Okay, so this is one thing. Then, for example, other thing you can divide, like uterotonics, which uterotonic is important for, to be avoided in certain condition, which is preferable in certain conditions. Similarly, tocolytics, okay, hemorrhage, like maneuvers to control the hemorrhage. So there are some anesthetic maneuvers, there are some surgical maneuvers, there are some radiological maneuvers. Okay, so like you should be knowing that these are the points you should be revising in one day. Like your target should be that you revise these points in your as part of your quick revision. You can do this. How you can do it? You can do it by opening the charts. Okay, the whatever notes you have made, or if you are studying from articles, you can just see the key points. There are some charts, and then this one the just headings. So you will be finding a number of things out of those things. What will be the advantage? You will not miss anything. Similarly, again, for gynae ops, other important topics are, for example, PIH, okay, cardiac diseases in pregnancy. Okay, so PIH, usually the question, what it comes at how to differentiate between the preeclampsia and eclampsia. And in preeclampsia, PIH, actually there are three things. One is control of blood pressure. Other is control or prevention of fits. Okay, and third is delivery of baby. These are, so whatever question they will be asking you will be on these things. So how you can differentiate, because maybe the first thing to do answer will be different. Like they will be giving you a scenario, the blood pressure is high, there are some systemic involvements, and that much weeks, for example, the baby is 30 weeks, and systemic involvement, and blood pressure is very high. So first thing to do will be control of blood pressure, or for example, so in the scenario we'll be able to know the answer whether will be magnesium sulfate or labetalol. Okay, and for example, if they are asking you what is the best management or definitive management, the answer is the delivery of the baby. Okay, the best management, because the PIH cannot be settled till the baby is delivered. Okay, so this is how you will be able to differentiate. So similarly, like cardiac diseases, because if you have some cardiac disease and the patient is pregnant, or they can ask you obesity in pregnancy, trauma in pregnancy. Okay, so clinical conditions or diseases in pregnancy. So the basic rule you will remember that it will be 1 + 1 = 3, not 2. Like the effects will be exaggerated. Okay, effects will be exaggerated. So this is the basic thing which you can do. And then you can just think that, for example, if you have a cardiac patient, so probable things will be that the patient will be on warfarin or any heart failure treatment. So you should be thinking that whether you should continue these things during pregnancy, and if they are continuing, what will be the effects on the pregnancy as well as on the fetus. So this thing should be in your mind. So similarly, you can just chalk it out. And another thing which they can ask you is about fetal heart rate. Okay, what are the danger signs? Another question related to a fetal heart rate, similarly, is intra uterine fetal resuscitation. Okay, actually it is just how you do this tilt, uterine tilt, and you give oxygen and you stop synto if there is some danger fetal heart rate. And of course you go for, maybe even you need to give tocolytics. Okay, and you may go for delivery of the baby by a cesarean section or normal delivery, whatever the scenario will be. So you should be knowing, they can ask you that what fetal heart rate changes are dangerous. So you should be knowing about it. Okay, then they should be knowing, you should have a concept, because if they ask you, you may confuse what is placenta previa, what is placenta accreta, what is placenta percreta, what is placenta increta. Okay, what is vasa previa, what is cord prolapse, what is this one abruption. Okay, another important question which they can make a scenario is maternal collapse. Okay, so MCQs sometimes they are coming on this topic, and they will be giving some hint about The question may be on the diagnosis, or maybe in question, or will be on the management. So you should be knowing what will you be doing. Okay. So the like purpose, what I am giving you the hint, that try to revise that unit in a target oriented way, rather than reading all the pages. Just try to target out, see the heading, see what may be just become an examiner and think what may be the question which can be formed, and just try to recall and review and revise so that you don't miss it. So this is one example, and you can apply this to all the important units. The same thing you can do for gynae, same thing you can do for pediatrics, same thing you can do for elderly. Okay, because no paper will be finished by these extremes. Then there may be some questions about smoker, there may be some questions about alcoholic. Okay, there may be some questions about so the question will be related to the smoking change, when it occurs, and how it can be reversed. What are the effects? And so you should be targeting like that. Now, like in neuro, if you just think about neuroanesthesia, you should be thinking about ICP. What factor increase, what factor decrease, how to monitor. Okay, and what are the anesthetic factor, what are the surgical factor, what are the patient related factor. So any question will be related to ICP. Okay, so it should be very clear. Like if CO2, what is the effect of CO2 on ICP? How it increase or decrease? O2, temperature. Okay, and other physical factors or things like that. Cerebral perfusion pressure. Okay. So, and how will you monitor? What are the clinical parameters and what? So whatever question you see, now you think like that, and then you open the book, and then you will come to know that any question which are coming to neuro, most probably they will be, or for example, if it is injury, because it may be neurological problem, may be because of injury or because of some tumor. Usually, there may be some other reason. So injury will be as a part of trauma. Okay, and the tumor will be because there may be some neurological deficit, but the whole again thing will be going towards the ICP. Even in the anesthesia care, that same parameters will be there. That you have to take care of CO2, you have to take care of O2, you have to take care of temperature, you have to take care of the physical things which can affect the ICP. Okay, because that will be causing neurological injury. If it is in the case of injury, you have to prevent the patient from secondary brain injury. So whatever questions will be, they will be trying to know that how to avoid the secondary brain injury. So you should be knowing the parameters, how the different factors are affecting the ICP. Okay, so this is, so now I will be just trying to figure out something like related to diseases, related to pharmacology, related to equipments, okay, and related to surgery. Like 4 things if I just target, because physiology will come in the disease. So like you just try to make a list of the diseases, okay, and just try to think what is the main problem in that disease, okay, and how, like what is the like basis of that disease, because any question which they will be making will be according to what that disease is, how this disease occur. It may be because of some receptor, it may be because of some endocrine problem, it may be because of some autoimmune disease. Okay, like reason may be anything. Like for example, receptor disease is myasthenia gravis. Okay, endocrine problem related to, for example, hyperthyroidism or hypothyroidism, for example. Autoimmune disease, there are so many autoimmune disease, rheumatoid arthritis, ankylosing spondylitis, things like that. Like you can make a list that what that disease is, and then what are the systemic effects. And usually you should be just thinking in your mind one by. If you think like that, if you revise like that, I guarantee you will be able to pick the question. So CNS, CVS, respiration, liver, kidney, okay, endocrine system, and things. You can make your own list, and you will see maybe in some disease there will be effect on more on, like for example, if it is myasthenia gravis, the effect is on neuromuscular system, okay, neuromuscular system. But because it's an autoimmune disease, myasthenia gravis, so it has multisystemic effects, okay. So, and then some effects will be because of the treatment patient is taking. So the systemic effects also because of the treatment, like there are some medications patient will be taking. So you should just think, just scan your mind that the patient is taking steroids, for example, patient is taking these this one anticholinergics, okay. So this will be your target will be, and then just think about similarly in the disease, you see that what is that disease, what are the systemic effects, and then you think about anesthesia, okay, and you think about all the steps of anesthesia, like which are pre-operative optimization or preparation, then something which you prepare, that whether you want to proceed or you want to proceed or delay, okay. Then you plan the mode of anesthesia. You should think about airway control. You should be thinking about acid prophylaxis, whether you need it or not. Any, like you, this is actually the anesthesia planning, which I have discussed multiple times, but I'm just giving you a hint. When you are reading a disease, scan your mind like that. Is there any pre-operative optimization you need? Like example is, for example, patient is anemic, you have to correct the anemia. Patient is having COPD patient, you have to treat the infection, you have to treat the bronchospasm, you have to give some positional strategies, like you are doing some postural drainage, you are doing incentive spirometry. If there is pleural effusion, you are tapping it, or antibiotics, things like that. So you think that any disease need optimization. So this will be the pre-op optimization. Proceed or delay, mode, airway. And then you will be thinking about any specific monitoring needed in that patient. So for example, if your mind should be that if you are dealing with any neuromuscular disease, you should be taking care of the neuromuscular weakness or altered response of the medication. So you will be doing the neuromuscular monitoring. If you are dealing any patient in which there is chances of bronchospasm, so you will be looking at the airway pressures. You will be, maybe you need ABGs, even intraoperatively. So ABGs is also part of monitoring the patient, okay? You are doing these point of care testing for monitoring it. So things like that, like whether you are using, you can just think about inhalational agent, think about the IV induction agent, think about muscle relaxant. Another important thing related to airway is whether you anticipate and how to do it, whether you are doing it with LMA or iGel, whether you are doing it with PTT, whether you need fiber optic, okay, whether you will face problem in ventilating the patient, whether you will find patient doing laryngoscopy, endotracheal tube, like you will be just thinking about in that way, okay. So similarly muscle relaxant, and then very important part is analgesia, okay, that how you will be giving analgesia in that disease, what fluids, how to recover, okay. And in that, like also related to surgery, that any specific perioperative complication, okay. Like for example, if you have a patient with diabetes mellitus, because of autonomic neuropathy, you will expect sudden collapse or exaggerated responses, airway manipulation to anesthesia medications, you will be expecting. So for that purpose, you think that there should be intra-arterial blood pressure, or you are using titrated doses rather than sudden giving, okay. So things like that, you will be thinking in each and every step of anesthesia care about any disease. any medication patient is taking, any procedure patient underwent, any like chemotherapy, radiotherapy in case of cancer, if that disease you to consider it as cancer. If there is some tumor secretion, you will be expecting that thing. So this is related to diseases. If you think, consider about equipment. So this is also revision. Yeah, like you are not reading each and every part, you are making what are the possible equipment or possible monitoring you are doing. So just think of like that, the temperature monitoring, scavenging, okay, humidification. I have made these all lists for you, vaporizers, okay, breathing circuits, okay, and some things which are not related directly to anesthesia, maybe diathermy, okay. You are not using all the time, but of course defibrillator you can make. And the main thing which you will be doing, what is the working principle, how this work, how you do it, how you like you use that, how you use that equipment, okay. What are different types? For example, if you think like that, Untitled CO2, whether the working principle is infrared gas analyzer, okay, this is one thing. The other working principle also here is also that Beer-Lambert law, because of the path length and path the concentration of solutes. So these are two things. And then what are different types, whether it is side stream or it is mainstream, okay. Then how to interpret the data, how to interpret the data. This is true for all equipment, believe me. This is what I'm telling you. How to interpret the data, how to do the troubleshooting. Troubleshooting means if, for example, there is error or something, how you what you do, and then what are limitations. Okay, so for example, if, as per to limitation, it will not work if the patient is cold, hyperfusion is low, patient is using some henna, patient has some abnormal hemoglobin, methemoglobin or carboxyhemoglobin, carbon monoxide poisoning or things like that. So this is the limitation. Similarly, how to measure the temperature. Temperature, you will be thinking, one is core temperature, one is body temperature, okay. And you will be then thinking how to, from where, which are the sites which you can use for core body temperature, okay. And so things like that. So this is all about equipment, working principle, how to use it, what are the troubleshooting, how to interpret the data, and like what are the possible complications. Like for example, if you are using Untitled CO2 in a pediatric patient and it is side stream, maybe it is taking a lot of volume. This may be important if you are doing a surgery in a neonate whose weight is 2 kg or 1 kg. Then even 1 ml or 2 ml or 3 ml which is lost is important. It is significant. Okay, so that is how you should be targeting any equipment. Then you can make a list of all the laws, formulas. Make your own list, like all the gas laws, all the laws related to anything. Just think, what are Beer-Lambert law, Bernoulli's principle, Fick's principle, Dalton's law of partial pressure. What is their clinical implication? You make your own list. Maybe you will find 20 or 30 or 50, no problem. Just think about them and revise them. Maybe you can make one day for these equipment and laws, okay, laws and then formulas. Formula for correction of sodium potassium, formula for allowable blood loss, okay, and things like that. You can have a list of the formulas, okay. So one thing you will be doing it is a list of formulas and laws, okay. Then as I told you, pharmacology, because pharmacology questions will be there, a number of pharmacology directly or indirectly. So again, I ask you when you are revising it, just make a list, group of diseases, group of medications. Like there will be some medications which are related to main party of anesthesia, inhalational agent, IV induction agent, local anesthetics, neuromuscular blocking agents, okay, vasopressors, vasodilators, Okay, then inotropes, then antihypertensive agent, anti-anginal, anti-heart failure. I'm sorry for this anti-heart failure. So you can make your list, and then you can see which medications are there for use intraoperatively, which medications are in the clinic in outpatient use. And then what we will be knowing about it. What is the mechanism of action? What is the group? Okay, whether it is occurring on any receptor, whether it is occurring on any pathway, like some diuretics, they are acting on the renal tubule and things like that. Like you should be knowing about the mechanism of action, any specific group or category. Like for example, you can make your own list of certain, I will just tell you that one also, but you will be saying what are the systemic involvement, what are the side effects, and specifically anesthesia interaction. Like the example for it is, for example, some medication prolonging QT interval, some are enzyme inducers, some are enzyme inhibitors. Okay, some will cause what you say, risk of PONV, which medications, okay, prolonging of neuromuscular blocking agents, exaggeration of anesthesia response. Just make a list, which are enzyme inducer, which are enzyme inhibitors, which cause, which are safe in porphyria, okay, which are problematic in a patient with epilepsy. You can just make a list of it, and then it will be easier for you to remind that this patient, this medication has this problem. Like for example, if you have a patient with problems related to dopamine, you will be avoiding metoclopramide. Okay, but remember, you can use domperidone, which is available oral. So you can still use antidopaminergic in a specific way. Then, for example, you will not use ondansetron in a patient with arrhythmias, especially if there is suspected QT interval prolongation. Or you will not use lithium. Not all patients who are taking lithium is used in modern anesthesia in LIDCO for cardiac output monitoring. Okay, so this is how you should be revising. Then I guarantee you, when you will open and you will see the MCQ, you will have no problem. So this is how you should be targeting pharmacology, and pharmacology should be very, very clear, because there will be so many questions from pharmacology in any exam, and specifically in intermediate module. So you should be knowing what are the pros, what are the cons, what are the usage, what are the selling points, what are important things of these medications. Okay, so related to surgery, because you should be having, because MCQ, when it will be coming, it will be only telling you laparoscopic surgery, and if you don't know what is laparoscopic surgery, you will be in trouble. Okay, should be knowing the physiological effects, insertion of trocar, pneumoperitoneum, and then CO2 absorption. So you will be thinking about it. Like for example, any surgery in which there is any critical step involving vagus nerve, so you will be thinking about bradycardia. So maybe they will not tell you the patient is having laparotomy going on, not laparoscopy specifically, because there is a stretch, and if it occurs, it means your anesthesia depth was not good. One of the, if you want to avoid this bradycardia response, the best and main thing you should be doing is that you should be maintaining the depth of anesthesia. So, but usually the surgery, how you task, what is the urgency of surgery? First thing, because in MCQ, they will be writing the name of surgery. And if you don't, you have to scan your mind in these things. What is the risk involved? What position that surgery is undergoing? What is the incision? How much is usual duration? How much, what are the analgesia choices in these patients, in that surgery? What are the critical steps? Like I give you example, that any patient having orthopedics, if they have not written, they will not tell you, but if they have written any orthopedic surgery, you should be thinking about tourniquet. You should be thinking about fat embolism. You should be thinking about venous thromboembolism. You should be thinking about bone cement. You should be thinking about pain, severe pain, even before anesthesia. You have to think about it. Okay. And then bedridden patient. So you will be having a risk of VT. So that the name of surgery will tell you a lot. So whenever you are targeting any MCQ in your intermediate module exam, and this is true for any anesthesia exam actually. So you should be thinking, just make a list.
हाँ मैं बता देना यार.
Okay. So this is how you should be targeting. Okay. So if I just summarize what I have told you up till now: diseases, pharmacology, physics equipment, laws and formulas. Okay. Then surgery. What else being asked? Zishan, just help me out. Anything if I'm missing? Because that is, if you make your revision like that, believe me, that physiological, especially like as in obese, as in pregnant, as in elderly, as in neonate, as in pediatric, as in smoker, as in alcoholic, as in steroid dependent, as in opioid addict. Okay. And then out of OR, yes, out of OR, ambulatory anesthesia, like endoscopies, MRI, patient with special care, not where it gone? Yes, I thought there is a magic going on. Things are going away. Anyways, and then is all not in this category, but patient with pacemaker. Okay, patient with intra-aortic balloon pump. Yes, another thing which I forgot is investigations. Okay, you should be knowing about all the possible investigation. I have made in the how to study link. I have made a list of investigation, all possible. Think about CBC, think about LFTs, how to interpret, think about thyroid function tests, think about serum electrolytes, think about this one, renal function test, think about chest X-ray, think about ECG, think about echo, think about thallium scan. Because, for example, if they have given you a scenario, if you have a patient with some cardiac problem, and now they will be telling you some data, and they will be asking you what will be the investigation you will be ordering. So if you don't know what is the rationale of doing echo or rationale of doing thallium scan, in which patient you will do thallium scan, in which patient you will do echo, in which patient you will go send the patient for angiography. So if you don't know the rationale of those investigations, how you will be able to understand? And remember one thing, it is very easy, but at the same time, it is very difficult. If you prepare like this, I can guarantee you the question, the answer will speak to you. Hello, I am the answer. But for that, you need to study like that. Okay. Still in this remaining days, you can prepare, and this message, because unfortunately for the people who for whom I made this session, none of them is here. It's an honor for me that none of you is going for IMM exam. I took their time, and none of them is here. Then, are you going for IMM exam? Anyone is around here? Any questions before I finish? Anyone wants to speak out anything?
I am not going for IMM exam.
I'm sorry?
I don't understand. Anyways, I think we will finish here, and best of luck to the people who are not here. Thank you.